careful. This medication that millions of people take every single day may be weakening your bones from the inside, making them more fragile day after day until suddenly an unexpected fracture happens. And that's the real danger, because you may feel perfectly fine, eat healthy foods, walk every day, avoid smoking, and still, at any random moment, with just a simple stumble or a small fall, the bone can no longer handle the pressure. It breaks, and within seconds your life completely changes. In the clinic, I see this very often. People who never showed any obvious signs of osteoporosis or bone weakness suddenly suffer a fracture out of nowhere. But when we carefully look back at their history, the same pattern appears again and again. Common daily medications that slowly disrupt the natural balance of the bones and weaken them silently from the inside over time. I am Dr. Beller, and in this video, I'm going to talk about 5 very common medications that can weaken your bones over time and increase your risk of fractures. And let me warn you right now, number 1 is the most overlooked of all, and as a doctor, it is the one that concerns me the most because it is sold over the counter. You probably already have it in your home and use it regularly thinking it is completely harmless. And pay close attention, because at the end of this video, I'm also going to explain a very common mistake with vitamin D that I frequently see in my patients. Many people believe they are taking it correctly, but in reality, they may be damaging their bones without even realizing it. Now, an extremely important clarification. This video is not meant to tell you to stop taking any medication. If your doctor prescribed it, there is a reason for it. The goal here is for you to understand what you are taking, become aware of the possible side effects, and during your next medical appointment ask one very important question. Could this medication be affecting my bones, and should we monitor it more closely? I want you to understand something because it changes everything. Your bones are not like solid rocks. Bone is actually a living tissue that is constantly renewing and remodeling itself. Imagine it like a construction site that never stops, where 2 different teams are working every single day. On one side, there are cells called osteoblasts. Think of them as the builders. They create new bone, place calcium and minerals into the structure, and strengthen the skeleton. On the other side are osteoclasts, which work like a demolition crew. Their job is to remove old bone tissue that is no longer useful, so new bone can replace it. When these 2 teams work together in perfect balance, one building while the other removes damaged material, the bones remain strong, healthy, and resistant. But the problem begins when that balance is disturbed and the demolition team starts working faster than the builders. Little by little, the bones begin to weaken internally, even though they may still appear normal from the outside at first. A fragile bone is like a house where every single day you remove bricks and break walls without rebuilding at the same speed. Eventually, the structure becomes too weak to support itself and collapses. That is exactly what can happen to your bones over time. And this is the most important part. These medications, especially when used for long periods, used incorrectly, or combined with certain risk factors, can interfere with that natural balance and cause you to lose bone faster than your body can rebuild it. So let's begin with the list. And I want you to do something very simple while watching this. As I mention each medication, write it down. Then later, go to your medicine cabinet and check whether you are taking any of them. But don't focus only on the large brand name printed on the front of the box. Look carefully for the active ingredient. The smaller name, usually written on the side or back, that is the true name of the medication. Let's start with number 5, medications used for anxiety and depression. Millions of people take them every single day. Medications like sertraline, fluoxetine, and paroxetine probably sound very familiar to you. And let me make something clear. This does not mean these medications are bad. In fact, they help many people and can be extremely important for mental health treatment. However, when they are used for long periods of time or in high doses, they may affect the natural balance of the bones in some individuals, especially if preventive measures are not taken early. Slowly and silently, the bones may begin losing strength, becoming more vulnerable to fractures over the years, often after very minor accidents such as small falls or light twists. So if you are taking one of these medications, this is not about stopping the treatment, especially if it is helping your mental health. But it is important to think beyond the immediate benefits and ask yourself a very simple question. Is my doctor monitoring the health of my bones? Should I be taking calcium, magnesium, vitamin D, or having a bone density check this year? Bring those questions to your next medical appointment, because asking them early could one day save you from a serious fracture. Now let's move on to number 4, a group of medications that many people use for migraines, chronic nerve pain, anxiety, and neurological conditions such as epilepsy. I'm talking about medications such as carbamazepine, phenytoin, and phenobarbital. You may not recognize these names immediately, but they are much more common than most people realize. So just to be safe, take a look through your medicine cabinet, because you might already have one of them at home. And here comes the key detail. These medications make your body use up vitamin D much faster than normal, and over time this can seriously affect the health of your bones. And why is this so important? Because without vitamin D, your body cannot properly absorb and use calcium. It's almost as if the doorway that allows calcium to enter the bones is closed. You may eat healthy foods rich in calcium, you may even take supplements every day, but if vitamin D levels are low, that calcium simply does not get incorporated into the bone the way it should. And do you know what worries me the most about this? It happens slowly and silently without obvious warning signs. The bones gradually weaken from the inside, until one day, completely unexpectedly, a fracture occurs. Sometimes it happens during something as simple as getting up to go to the bathroom at night. That is why, if you found any of these medications in your home, it is worth checking your vitamin D levels at least once a year. This is not just another routine blood test. It is a way of monitoring your bone health, understanding where your levels stand, and deciding whether you may need to adjust or supplement vitamin D. Now, something extremely important. Never stop taking this type of medication on your own without speaking to a doctor first. In some cases, stopping these medications suddenly can be very dangerous. All right, now let's move on to number 3, the thyroid medication called levothyroxine. It is one of the most commonly prescribed medications for treating hypothyroidism, especially in women. And I want to make this very clear. The problem is not the medication itself. When it is properly prescribed and taken at the correct dose, it performs its job very well and can greatly improve quality of life. The problem begins when people continue taking it for years without regularly checking their hormone levels, and the dose ends up being higher than what the body actually needs. When that happens, the body starts functioning as if it had an excess of thyroid hormone, almost like hyperthyroidism, and that causes the bones to break down and wear out much faster. And do you know what concerns me the most about all of this? It happens silently. There is usually no pain and no obvious symptoms in the beginning, but over the years the bones slowly become weaker and more fragile. So if you have a box of levothyroxine at home, ask yourself this. When was the last time your doctor checked your dose? How long has it been since your thyroid levels were monitored? Many people begin with one dosage and continue taking the exact same amount for years without adjustments. But what was correct 1 or 2 years ago may now be more than your body actually needs. And not only that, it is also important to check your levels of vitamin D, calcium, and magnesium and determine whether you might benefit from supplements. Bring these questions to your next medical appointment because adjusting the treatment at the right time not only improves thyroid health, but can also help prevent fractures and loss of independence later in life. Now pay very close attention to the next 2 medications because they are the ones that cause the most damage to the bones when used incorrectly. Number 2, oral or injectable corticosteroids. Medications such as prednisone, prednisolone, and dexamethasone are very commonly used to treat asthma, allergies, arthritis, and many other inflammatory conditions. Here's what happens. These medications damage the bones in several different ways at the same time. First, they slow down the formation of new bone. It is almost as if the construction workers simply stop building. At the same time, they reduce the body's ability to absorb calcium from food and also increase the amount of calcium lost through the urine. The result is devastating. Less calcium enters the body, more calcium is lost, and the builders responsible for creating new bone stop working properly. Your doctor may have already warned you about this side effect of corticosteroids, but what many people do not realize is just how quickly this process can happen. In some cases, these changes can begin appearing after only a few months of continuous use. We are not talking about years here. We are talking about months. And this is where something very important comes in. You may be thinking, I don't take corticosteroids. But are you really sure about that? Have you checked that injection you received for lower back pain, knee stiffness, or shoulder inflammation? Many of those injections also contain high doses of corticosteroids. That's why awareness is so important. So what is the key when it comes to these medications? Use them only when they are truly necessary, at the lowest effective dose, and for the shortest amount of time possible. And in many cases, it is also important to supplement with calcium, vitamin D, and magnesium to help protect the bones while using them. Now, all the medications we've discussed so far have something in common. They are usually prescribed by doctors who are already aware of these side effects, and in most cases, patients are warned and preventive measures are taken to reduce the risk of damage. But number one is different. This is a medication that millions of people take on, their own for years, believing it is completely harmless, without medical supervision or follow-up, while slowly weakening their bones without them even noticing. I'm talking about antacids that are sold over the counter. Medications like omeprazole, pantoprazole, and lansoprazole. You've probably heard of them before. They are commonly used for acid reflux, gastritis, and heartburn, and when used for short periods of time, they can be very effective at relieving symptoms and healing stomach ulcers. The problem begins when they are used continuously for long periods. Here's why. These medications reduce stomach acid, and while that helps digestive symptoms, it can also interfere with the absorption of important nutrients, especially calcium. Without enough stomach acid, calcium from food is not absorbed properly, and over time this directly impacts the strength of the bones. And that's not all. These medications can also affect other important minerals, such as magnesium and, in some cases, iron, leading to muscle cramps and even anemia. Now, none of this happens overnight. It is a slow and silent process, but over the years it can make your bones increasingly fragile. And this is the important part. These are not bad medications. In many situations, they are absolutely necessary and properly indicated. The real problem is starting them and then forgetting to stop them once the original problem has already been resolved. In my clinic, I hear patients every single day say they have been taking omeprazole for years and no longer even remember why they started it in the first place. So if you've been taking one of these medications for a long time, ask yourself this question. Do I still truly need this medication, or is it time to review it with my doctor? Now, as promised, let's talk about vitamin D. This is where I see one of the most common mistakes in medical consultations. Many people take vitamin D just in case, without knowing their actual blood levels or whether they even need supplementation at all. So as a doctor, let me leave you with 3 practical recommendations. First, not everyone needs vitamin D supplements. Ideally, your levels should be checked at least once a year, or more often if your doctor recommends it, especially if you are at risk or taking any of the medications we discussed today. Second, what levels are we usually looking for? In general, a blood level between 30 and 50 is considered appropriate for most people. And third, the correct dose is not the same for everyone. Some people do perfectly well with 800 to 1,000 international units per day, while others may require 2,000, 5,000, or even more, depending on their blood levels and individual needs. That is why the key is not simply taking vitamin D. The real key is adjusting the dosage according to your test results, because both deficiency and excess can cause health problems. Yeah.